Amyloidosis, as I told you, is a extracellular deposition of abnormal immunoglobulins into the soft tissue. So in the oral cavity, you see this enlargement of the tongue with multiple nodular swellings. It can affect any oral tissue, but predominantly it involves the tongue, leading to macroglossia. Macroglossia is nothing but a large tongue. But when you do a biopsy, you can see this homogeneous acellular deposits of the immunoglobulin in the connective tissue. So when you do a special stain, which is called Congo red, so when you're going to do a Congo red stain and see it under polarized light, you see this apple green birefringence. So with this apple green birefringence, you can confirm that this is amyloid material. So the treatment is you have to try to identify what is the cause that is leading to this deposition, and if you start treating the cause, this deposition of amyloid will stop. Okay. The next is deficiencies of vitamins. You already know there are various vitamins which are responsible for maintenance of your body, starting from your vitamin A, which is responsible for vision. It is also responsible for maintenance of growth and tissue differentiation. It is also responsible for your maintenance of epithelial tissues. Okay, so vitamin A is obtained from diet, usually from liver, or can also be synthesized in the body by consuming red and yellow vegetables that contain beta carotene. So vitamin A is very important for vision and tissue homeostasis. Vitamin B complex contains various vitamins, out of which B1 is thiamine, which is responsible as a coenzyme for various metabolic reactions, and thiamine is responsible for neuronal function. So there's going to be a thiamine deficiency. There is a defect in neuronal activity. Vitamin B2, riboflavin, is responsible for redox reactions. What is this redox reactions? Redox reactions are the ones which prevent the accumulation of free radicals in the body. Okay, and riboflavin is obtained from milk and green vegetables along with fish and meat. B3 is niacin. Niacin is also important for redox reactions. So it is also consumed from both animal sources and food sources. Vitamin B6 is pyridoxine, which is again a coenzyme for amino acid synthesis. So if you can see, B1, B2, B3, B6 all are cofactors and responsible for metabolic activity in the body. Vitamin C is ascorbic acid, which is very important for your collagen synthesis. If there's going to be defective vitamin C, your collagen formation is defective. Vitamin D is very important and is now considered to be a hormone because vitamin D is responsible for calcium balance, maintenance of calcium phosphate balance in the body. So vitamin D is secreted or it is generated by the tissue in the skin due to exposure of UV light, and this gets processed further in the liver and gets activated in the kidneys, which will regulate the calcium metabolism in the body. Vitamin E is alpha tocopherol. It is a fat soluble vitamin that is stored throughout the body and it is an antioxidant. So it is seen in vegetable oils, meats and nuts. Vitamin K is again another fat soluble vitamin which is seen in green vegetables, and it is very important for synthesis of clotting factors, especially 2, 7, 9 and 10. So these clotting factors are generated with the help of vitamin K. So deficiencies of vitamin A usually leads to blindness in the daytime. If it happens in adults, this vitamin A deficiency can lead to night blindness. Okay. And if it is going to be a thiamine deficiency, it is called beriberi. It is seen in alcoholics also, and people who don't eat a balanced diet, you can see this beriberi. Beriberi is usually also seen in people who consume a lot of polished rice. Okay. So the next is riboflavin. So riboflavin is important for producing glossitis, angular cheilitis, sore throat, and erythema. So what happens if there's going to be a deficiency of riboflavin? You end up with glossitis. Glossitis is what? Inflammation of tongue. What is angular cheilitis? Inflammation in the lips and in the corners of the mouth. It also leads to erythema. Erythema is redness of the oral mucosa. Niacin is a condition that calls pellagra. Pellagra means rough skin. Can you see here? You can see thickening of the skin where you can see that. So this is pellagra. Okay. So it is also due to deficiency of niacin. Oral cavity produces stomatitis. Stomatitis is inflammation of the oral cavity. Then you have glossitis, which is inflammation of the tongue. Then you also get deficiency of pyridoxine, which is usually rare, and it is commonly seen due to this anti-tuberculous drug isoniazid. So patients who are in anti-tubercular therapy can get these pyridoxine deficiency. Vitamin C deficiency is known as scurvy. Before, it is usually seen in sailors who used to travel between continents and they don't get sufficient amount of fresh fruits and vegetables. Okay, so it was seen previously. Now again you can get it in people who don't eat lot of fresh fruits and vegetables. You can see this vitamin C deficiency. It is called scurvy, and this scurvy involving the gingiva, it's called scorbutic gingivitis. So where you can see a soft red swelling of the gingiva, which is large, which is soft to touch, and whenever you touch it, it bleeds profusely. Okay, so what happens is scurvy can lead to a fatal outcome because of intracranial hemorrhage. So it is very important to identify vitamin C deficiency and treat it immediately because it produces capillary fragility. So what happens is this rupture of capillaries inside the brain can lead to intracranial hemorrhage and can lead to death. Vitamin D deficiency in children leads to rickets, and if it's going to see in adults, it is called osteomalacia. Okay, so this rickets can be seen due to defective bones. They can have enlarged chest, okay, which is called rachitic rosary. The children can show retarded growth. They are irritable to small stimuli. Okay, and even in old people, you can see it as osteomalacia, where the bone continuously keeps remodeling, but it is not mineralized properly, leading to weak bones, leading to fracture. Okay, vitamin K, as I said, is important for your clotting mechanism, and if there is going to be a defect in vitamin K, that leads to excessive bleeding. Even after some oral procedures, the bleeding starts, which is not controlled. Okay, so these are the importance of these vitamins and the oral manifestation which you can see due to its deficiency. So all these vitamin deficiencies can be treated with vitamin therapy, where you try to identify the vitamin which is deficient and you can supplement them through medicines. Okay, iron deficiency anemia is also important and is seen throughout the world, and it has four causes, usually due to either excessive blood loss, increased demand for RBCs, decreased iron intake, or decreased iron absorption. So usually in women, if there is going to be excessive menstrual flow, or there is going to be a bleeding disorder where you get internal bleeding or an external bleeding, you can get loss of hemoglobin, loss of RBCs, which can lead to this iron deficiency anemias. Okay, so what happens is whenever there's going to be an iron deficiency anemia, orally the important thing what you see is you can see glossitis, you can see atrophy of the oral mucosa. The patient's mucosa appears bland, your tongue appears bald, there is no papillae, there is atrophy, patient has severe burning sensation, patient has not intake spicy food. Okay, so all these can be seen. And a lab diagnosis, when you're going to see, you will see hypochromic microcytic RBC. So what is the meaning of that? Hypochromic means RBCs appear pale because the hemoglobin is not found properly. Microcytic RBCs are smaller in size, and even the total count of RBCs will also be less. That's why it's called anemia. Okay, and even the total iron binding capacity is also affected. Okay, the other syndrome which I told you important with iron deficiency anemia is a Plummer-Vinson syndrome, where you see inflammation of the lip, cheilitis, inflammation of the corner of the mouth, you get angular cheilitis, and you can see this atrophy of the papillae of the tongue, a smooth bald red tongue, okay, which is called glossitis. So in Plummer-Vinson syndrome, what happens is you can see these patients with angular cheilitis, glossitis, they have dysphagia. Dysphagia means difficulty in swallowing and sometimes even pain in swallowing. It is very important, as I told you, it is because it has a high frequency of oral and esophageal squamous cell carcinomas. So it is very important because it is a syndrome that shows glossitis, cheilitis with dysphagia. Patient has difficulty in swallowing and they have a high risk for developing squamous cell carcinoma. So iron deficiency anemia and Plummer-Vinson syndrome can come as an essay question in your exam. So you can see this tongue, there is hardly any papillae, smooth, bald tongue. This atrophy of oral mucosa is also commonly seen in Plummer-Vinson syndrome, and in iron deficiency anemia it's going to be severe. Patient also gets these esophageal web. Esophageal web is a tissue of abnormal value which you see in the esophagus that blocks the swallowing of food. They can also show spoon-shaped nails called koilonychia. Koilonychia. That's why whenever you examine a patient, you do a complete extraoral examination. You do a full body examination to see the nails, you see the conjunctiva, you see the sclera. Okay, to identify if there's going to be any other systemic diseases. Okay, so the treatment is to identify the cause for this iron deficiency and you have to treat it promptly to restore normalcy. Okay, so that is with Plummer-Vinson syndrome. The other question which I told you is important essay question is this pernicious anemia. Pernicious anemia, it is due to deficiency of vitamin B12. So for this vitamin B12 you have two components. You have an intrinsic factor which is secreted by the stomach which will help to absorb the vitamin B12 that is consumed. Okay, but what happens is if there's going to be external deficiency, that's called the external factor or the extrinsic factor. If there's going to be a defect in the intrinsic factor also, the vitamin B12 cannot function properly. So in most of the cases of pernicious anemia, patient does not have the intrinsic factor due to an autoimmune disease. There is destruction of the cells of the stomach which leads to deficiency of this intrinsic factor. It can also happen when there is a Helicobacter pylori infection, which can also lead to defective vitamin B12 absorption. Okay, so what happens is whenever you're going to see a patient with vitamin B12 deficiency, you can see this. You can see erythema of the tongue, which is seen by red areas. You can see atrophy of the papillae. You can see it by smooth areas. Okay, and once you start treating with vitamin B12, you can see the tongue restores back to normal. So whenever there's going to be a deficiency of pernicious anemia, patient can also have paresthesia, which is abnormal sensation in the oral cavity. They can have tingling, they can have numbness in the extremities, they can feel abnormal sensations in the fingers, in the toes. Okay, they can also have difficulty in walking. Patients can have depressions, they can have dementia, and intraorally you can see all these atrophic changes. And what happens is you're going to do a biopsy, can see this atrophy of epithelium with a mild chronic inflammation, which you can see in the underlying connective tissue. And as I said, this can be treated with vitamin B12 supplements. So with that, the vitamin deficiencies are completed. We go on to pituitary dwarfism, which is due to a diminished production of growth hormone. So as it happens in young individuals, the patient's growth is completely stopped. Patient appears to be short. They used to have defects in the developing bones. Okay, so which is you can identify them, they are going to be completely small. And what happens, but the mental status is usually normal. But if there's going to be an excess of your growth hormone, you can get gigantism if the bone formation is not complete. And if it happens in adults, it's called acromegaly. So this acromegaly can come as a short note in your university exam. Acromegaly, where you can see enlargement of bones, the bones become thickened, the bone becomes plumpier, because it happens after the closure of epiphysis. So epiphysis closes when you reach adulthood. So if you have any hormonal disturbance before the epiphyseal closure, it can affect the height of the individual. Once it happens after the closure of epiphysis, usually you end up with thickening of bone. Okay, so in this acromegaly, what you see is this. You can see enlargement of the face, you can see enlarged mandible. Okay, and when you see there is whenever going to be enlargement of the jaws, you will have dental malocclusion. So if you see this radiograph, can you see this dynamic enlargement of the mandible which happens in acromegaly? And usually most of them will have dental malocclusion, they have problems in the TMJ. So what happens is there is no specific treatment for acromegaly except for cosmetic corrections and trying to restore the balance If there's going to be a pituitary tumor secreting this growth hormone, it has to be relevantly managed. And most of the time, because of these hormonal imbalances, the patient will have hypertension, patient can show diabetes mellitus, patient can show respiratory disease, heart failure, even colon cancer. So when you're going to see any hormone imbalance, you don't restrict yourself to only one hormone. You have to check the effects of all the other organ systems in the body, because most of them are usually affected. Okay, so the next condition is called hypothyroidism. Hypothyroidism is where there is reduced levels of thyroid hormone. So when the thyroid hormones are less, you lead to this. You lead to excessive swelling. There is a tissue edema which happens in hypothyroidism. There is delayed eruption of teeth. Okay, but once you start giving thyroxine supplements, you can see the tissue edema subsides and the teeth also erupt properly. Okay, so this hypothyroidism can be due to an autoimmune disease where thyroid gland gets destroyed, like here Hashimoto's thyroiditis, where it is inflammation of thyroid gland, which leads to destruction of the secretory thyroid cells, that leads to defective thyroxine hormone. It can also be primary due to some abnormality in the endocrine axis, or it can be secondary due to inadequate amount of TSH. TSH is your thyroid stimulating hormone secreted by the pituitary gland. So it can be either primary hypothyroidism, where the thyroid does not secrete any hormone, or it can be secondary hypothyroidism, where the TSH is not secreted from the brain, which does not stimulate the thyroid glands to secrete thyroxine. So most of the time in hypothyroidism, you have bradycardia. Bradycardia means a slow heart rate, and the patient will have hypothermia, where there is reduced body temperature and the skin usually feels cold. The lips gets thickened, usually due to abnormal accumulation of glycosaminoglycans. You end up with this macroglossia. So most of the time in hypothyroidism, you get macroglossia. Again, in amyloidosis, you get macroglossia. In all that mucopolysaccharidosis and other lipid storage diseases, again you can end up with macroglossia. Whereas in various forms of anemia, you see that the tongue shows atrophy. There is loss of tongue papillae and you get a bald tongue. So in anemia, usually you see a bald tongue, whereas in the other hormonal diseases and lipid storage disease, you see enlarged tongue. And you can see that in hypothyroidism, again the teeth eruption is delayed. And you can see here, you can see multiple unerupted teeth. So once you start giving thyroid supplements, these teeth will erupt into the oral cavity. So that is the importance of thyroid supplements in patients with hypothyroidism. So you have to identify whether it is a primary or secondary. If it is primary, it is deficiency of thyroxine secreted by the gland. And if it's going to be secondary, there is deficiency in the thyroid stimulating hormone. The next important condition we must remember is hyperthyroidism. It is a case of dental emergency. It's called Graves' disease. It is usually due to an autoimmune destruction, okay, that directed against TSH on the surface of thyroid cells. So these autoantibodies binds to these receptors, then they stimulate thyroid cells to release inappropriate thyroid hormone. So it is an autoimmune disease where there is excessive secretion of thyroxine by the thyroid gland. So it is more common in women and it is a dental emergency. So whenever you are going to see a patient with exophthalmos, can you see the eyes popping out of the eyeball, popping out of the cavity in the orbit? So whenever you're going to see exophthalmos, always you have to be suspective of these Graves' disease. Patient will have weight loss in spite of continuous appetite. Patient will always feel hungry, they'll keep eating, but still they will keep losing weight. In hypothyroidism, I told you it has bradycardia, whereas here it is tachycardia, that is increased heart rate. Patient will be excessive perspiration, patient will be sweating a lot even in a AC room. Whereas hypothyroidism, I told you, patient will feel cold. So here there will be excessive perspiration and there is a widened pulse pressure. There is an increase in systolic but decrease in diastolic pressure. So the gap between a systolic and diastolic is extremely long. The patient's skin feels warm, whereas in hypothyroidism, the skin feels cold. And there is tremors. There is your small delicate vibrations of your fingers which can be seen. So this again, you have to do serological investigation to find out the levels of thyroid. and it has to be treated immediately, okay, with drug therapy. Because if there is going to be an excessive secretion, it happens, you get a thyroid storm, which is a dental emergency. So what happens in the thyroid storm? So you get a patient can show convulsions, patient can show very high fever and tachycardia. They should be immediately hospitalized, because if a thyroid storm happens on a dental chair, there is a 50% possibility that the patient may die on the chair. That's why you have to take a complete history, and you must also check the levels of T4 and TSH in the serum. In affected patients, what happens is only a T4 is high, whereas a TSH is normally low. Okay, so in hyperthyroidism, what you see is this. You see increased levels of T4, which is a thyroxine levels, and reduced levels of TSH. In hypothyroidism, what will happen is, if it is going to be primary hypo, T4 will be low, TSH will be high. Whereas if it's going to be a secondary hyperthyroidism, you will have your TSH levels also will be low. Okay, so that is your thyroid condition. The next is your hypoparathyroidism, which is due to defective parathormone. Parathormone works along with vitamin D and maintains the calcium level. So what happens is, parathormone is the one which tries to increase the circulating levels of calcium. Vitamin D tries to reduce the circulating levels of calcium. So what happens is, PTH is antagonistic to vitamin D. So if that's going to be defective parathormone, what happens is, the serum levels of calcium starts beginning to drop. Patients usually show hypocalcemia. They can show metabolic alkalosis. That means they will have increase in what you say, leading to hyperventilation. Okay, so here you see a Schwarzenstein. Schwarzenstein is when you tap the facial nerve, this below the zygomatic process, that will be twitching of the upper lip. So it is an important sign which will help you to identify this calcium imbalance. So here in hypoparathyroidism, the Schwarzenstein is positive, whereas if it is going to be a pseudo condition, a pseudo hypoparathyroidism is a condition where a normal parathormone is present, but the biochemical pathway that activates the actin of PTH is absent. So this happens in pseudo hypoparathyroidism. This is an extremely rare condition, whereas hyperparathyroidism is far more common. So where you get primary, where there is uncontrolled production of parathormone, whereas secondary happens when, due to low level of serum calcium, PTH is continuously secreted. Usually happens in chronic renal disease. So in chronic renal disease, what happens is, your vitamin D is not secreted. So without vitamin D, the calcium level starts falling down, and if the calcium level starts falling down, the parathormone starts secreting, which removes calcium from the bone and sends it into circulation to maintain a balance, leading to large bone cavities, which is called a Brown's tumor. So Brown's tumor is nothing but a granulomatous lesion in the bone due to osteoclastic resorption. So when you're going to do a radiograph, you can see this ground glass appearance. So ground glass appearance, you can also see it in fibrous dysplasia. Whereas here, along with ground glass appearance, you see this. There is no lamina dura. There is loss of lamina dura along with the ground glass appearance in hyperparathyroidism. Okay, and intraorally or extraorally, you can see a swelling in the bone, and when you're going to do a biopsy, it will show a giant cell granuloma. And because of this excessive calcium in the circulation and due to excessive osteoclastic resorption, you can get patient will have severe pain in the bones. Because of excessive calcium in the circulation, patient can have stone formation also. So this hyperparathyroidism, three words are there: stone, bone, groan. Groan means because of pain in the abdomen due to ulcers in the mucosa of the gastric system or even the intestinal system, you get severe abdominal pain. Patient will get severe groaning because of abdominal pain. Patient can have defective lesions in the bone, and it can also show stone formation Okay, that is what's called stones, bones, and groans. So when you're going to do a biopsy, you see this collections of large giant cells and the granulation tissue which replaces the bone and weakens the bone. So the treatment will be surgical excision and try to control the parathormone levels by supplementing with vitamin D and to remove any tumors which are responsible for the same. Okay, so the next condition is called hypercortisolism, which is your Cushing's syndrome. Cushing's syndrome is due to excessive glucocorticoids due to either a tumor in the adrenal or in the pituitary gland which secretes large amount of glucocorticoids. So patient will show abdominal striae, hirsutism, growth of facial hair, defective healing, osteoporosis, reduced mineralization of bone. They can see hypertension, which can also show depression, increased in sugar levels, hyperglycemia with thirst and polyuria. They can also show muscle wasting. So this is what you see in Cushing's syndrome, where you can see moon-like face due to excessive glucocorticoids. You can also get another condition. What is Addison's disease? Addison's disease is due to hypo, insufficient production of your glucocorticoids, which is called hypoadrenocorticism. So it's usually due to autoimmune destruction, inflammations, or even metastatic tumors. So what happens is, in this condition, you can see abnormal pigmentations happening all over the skin. You can also see them in the oral mucosa also. So this hyperpigmentation is called bronzing. So wherever your sun gets exposed, your skin color becomes bronze. Patient can have stomach upset, nausea, vomiting, diarrhea, weight loss, and what happens is you have to check the levels of ACTH and the levels of your serum glucocorticoids. Okay, so by comparison of both levels, you will try to identify what condition it is. So diabetes, you're already aware, there is excessive circulating levels of glucose due to either defective insulin or reduced uptake of glucose by the from the circulation by the tissues. Okay, so you have type 1 which is dependent on insulin, type 2 is a non-insulin dependent diabetes. And what happens is patients will have polyphagia, polyuria. So polyphagia will, they will feel hungry. Okay, they will have polyuria where they have frequent urination. They also have polydipsia, they feel thirsty. Okay, so this is the signs of diabetes mellitus. Intraorally, what you see is, you can see periodontal disease and gingival disease are occurring in high frequency. You can see bone loss, you can see gingival recession, you can see mobility of teeth, and you can also have the other microangiopathies which can lead to defective chemotaxis of neutrophils. So diabetes mellitus is also important. It can be treated with insulin or other supportive drugs. Okay, oral hypoglycemics. Okay, hypophosphatase is a condition where there is a deficiency of alkaline phosphatase. Alkaline phosphatase is an enzyme that is responsible for bone mineralization. So if this alkaline phosphatase is less, bone mineralization is affected. So you have four types: perinatal, infantile, childhood, and adult, based on differing severity. The important thing is you can get premature loss due to lack of cementum formation, and you can also have delayed eruption of teeth also. Okay, so this is your hypophosphatasia, where you can see that the pulp chamber has a large pulp horn, but your cementum formation is defective. Okay, and you can see cementum is not there, no cementum, you can see only malformed radicula denti. Okay, the last three which I told you are an autoimmune inflammatory condition, which is your Crohn's disease. It's also called regional enteritis. It is a part of orofacial granulomatosis, where you see multiple granulomas involving the face and the oral cavity. You can see granulomatous lesions, multiple linear ulcers in the oral cavity, and you're going to do a biopsy, you'll see a non-necrotizing granuloma. So Crohn's disease is important because it can be associated with increased risk of malignancies. Okay, and what happens is you can also give an immunosuppressive drug, azathioprine can be given to control this condition. Okay, the last one is your pyostomatitis vegetans, which is very rare, and what happens is it is part of your inflammatory bowel disease, your ulcerative colitis or Crohn's disease can also show these oral findings. You can see this multiple snail track ulcers in the buccal mucosa. You can see them in the soft palate and the oropharynx. And usually once you give steroids, this inflammation subsides. Okay, so this is your pyostomatitis vegetarians. And the last one is a uremic stomatitis, which you see in patients with renal failure due to excessive levels of urea and nitrogenous substance in the bloodstream. Patient will have a uremic breath, and intraorally you can see these white patches on the tongue. Okay, so with this we have summarized the oral manifestations of systemic diseases. So if you have any doubts, you can ask me. So this session is finishing. I will re-log in again, and your class rep has to send the attendance. Now once I re-log in, you can type your attendance in the chat. Okay.